All right, let's dive into a story that's equal parts heartbreaking and eye-opening. Imagine this: a family in their 70s, caring for their adult son with autism, severe mental illnesses, and physical health issues. Sounds intense, right? But here's the kicker: they are essentially trapped in a system that feels like it's designed to fail them. This isn't just their story, it's a mirror to a much bigger issue in mental health care. So, let's break it down. First off, Michael's situation is extreme, but what's really striking is how his family's experience highlights the gaps in the system. Personally, I think what makes this story so compelling is how it exposes the disconnect between the severity of someone's condition and the support they actually receive. Michael's parents are in their 70s, caring for him around the clock, dealing with psychosis, OCD, and even instances of him starting fires. Yet, because he refuses assessment, the system can't, or won't, step in. It's like the system is waiting for a catastrophe before it acts. And that's just wild to me. If you take a step back and think about it, this isn't just about Michael, it's about how we, as a society, prioritize mental health. One thing that immediately stands out is the legal threshold for intervention. The family argues it's way too high, and I couldn't agree more. The system seems to operate on extremes: either you're in a full-blown crisis, or you're on your own. There's this massive middle ground where people like Michael fall through the cracks. Tessa Munt, their MP, nails it when she talks about the walloping great gap in services. We've got brilliant organizations for milder cases and intensive care for acute crises, but what about everyone in between? It's like we've built a safety net with huge holes in it. What many people don't realize is how this isn't an isolated case. Marjorie Wallace from the charity SANE says they hear stories like this all the time. Families are left carrying this enormous burden, often with no real support. And here's where it gets even more frustrating: the government's response feels like a band-aid on a bullet wound. They talk about investing in mental health services and developing a new strategy, but how long will that take? Families like Michael's are suffering now. It's easy to announce reforms, but the real question is, will they come in time for people who need help today? From my perspective, this raises a deeper question: why do we treat mental health so differently from physical health? If Michael had a severe physical illness, would the system be this slow to act? Probably not. Mental health is still stigmatized, underfunded, and misunderstood. And that's not just a systemic issue, it's a cultural one. We've got to stop treating mental health as a secondary concern. It's not just about beds or services, it's about recognizing that mental health is health, period. A detail I find fascinating is how this story intersects with broader political promises. Prime Minister Andy Burnham talks about speeding up social care reform, but will mental health get the attention it deserves? It's easy to focus on physical care, but mental health support needs to be part of that conversation. Michael's family is right: mental health should be treated with the same urgency as physical health. But will that actually happen? I am skeptical, to be honest. It feels like mental health is always the afterthought in these discussions. If you take a step back and think about it, this story isn't just about one family's struggle. It's about the thousands of families out there who are silently dealing with similar situations. It's about the professionals who want to help, but are handcuffed by a broken system. And it's about us, as viewers, as citizens, asking ourselves what kind of society we want to be. Do we want to be the kind that lets families like Michael's fall through the cracks, or do we demand better? Personally, I think this story should be a wake-up call. It's not enough to just feel bad for this family, we've got to push for real change. Whether that's advocating for lower intervention thresholds, more funding for mental health services, or just treating mental health with the same urgency as physical health. Because at the end of the day, this isn't just about Michael or his family, it's about all of us. What this really suggests is that the system isn't just failing them, it's failing all of us. And that's something we can't ignore. So, here's my closing thought. What's one thing you can do to help? Maybe it's sharing this story, supporting mental health charities, or just having a conversation about it. Because change starts with awareness, and awareness starts with stories like this. Let me know your thoughts in the comments. How do you think we can fix this? Let's keep the conversation going.